Thank you. Good morning, everyone. Thank you for joining. My name is Ryan Tuckmeyer. I'm the Director of Emergency Management here at Cedars Sinai, and want to share this morning a little bit about our implementation of the earthquake early warning system, tell you how we found out about it, why it was important to us, and go through some of the funding opportunities and some of both the successes and challenges with implementing the system so that if you're interested in doing this at your facility, kind of you have a roadmap going forward for what may be in store for you or how to take the next step or first step. So why is this important to us? Well, Cedar Sinai has locations all over the Los Angeles metropolitan area. And as I'm sure many of you know, we're in an earthquake zone. So just looking at some of the faults here around the medical center, we know that earthquakes are a very high probability for us, and we want to mitigate that as best as we can. So knowing that we're in an active earthquake area really helped, drive this initial part of the project. Also, we have organizational experience with an earthquake. From the 1994 Northridge earthquake, there was a lot of damage to this campus. There were some buildings that were red tagged and had to be torn down and replaced. There was also just a lot of non-structural damage to the existing hospital and a lot of losses there. Nothing catastrophic, but there were definitely some opportunities to help prevent or mitigate some of those losses. As I'm sure most of you do, we do a hazard vulnerability analysis. We update ours on an annual basis, and earthquake is always one of our top hazards, definitely within the top five. Even though we haven't had a really large earthquake in our area since 1994, we know that the possibility is always there, and it's something that we really have to focus our preparedness on. And this system overall really gives us the opportunity to save lives, reduce injuries, and minimize damage. So we talk about how do you start funding this system, because obviously there's going to be a capital expense to this, and without funding, it's hard to even take some of those first steps. So the way we approached this was through the Hazard Mitigation Grant Program, which is operated and funded through Cal OES. It is in partnership with FEMA. And put the link here on the slide. The slides will be shared, but I'm also going to put the link in the chat here if you want to check it out. You can also just do an internet search for Cal OES HMGP. It'll get you right to that site. And the way we applied for this grant was under what's called the 5% initiative, where there was not a FEMA benefit cost analysis that was necessary at the time. When we started this in 2017, 2018, earthquake early warning wasn't either on Cal OES's or FEMA's radar really at that time. And so it wasn't an allowable expense under this grant, which is why I went for 5% initiative. I did just take a look at the site in the last few days, and big change since then is now earthquake early warning is actually one of their priority funding projects. So if you're interested in this, it is now allowable. Some of the regulations have changed a little bit about what you'll have to do for your grant application, but still the overall process, which I'm going to get into, will be still the same. And a key phrase here, working with the FEMA and Cal OES representatives, as one of the key ways to justify this under the grant is to use the phrase that it has the reasonable expectation to save lives and minimize injuries. There isn't a lot of hard data or studies out there yet saying the earthquake early warning system, prevented this damage from occurring or saved so many lives. But we can say that we do reasonably anticipate it to have those types of positive impacts. So for this grant application, you're going to want to take a look at the Cal OES website. You're going to want to take a look for any recent disasters. Going up on the website now, there are disasters that are active now where the Hazard Mitigation Grant Program will be effective to apply for a grant like this. It does happen obviously on a revolving basis, but California being kind of nature's playground, there's always something going on in the state, whether it's flooding or fires or an earthquake or something else that will make this funding available. And some of the key words that you want to look at is whether the hazard mitigation is available statewide or whether that mitigation's in your county where your organization resides. once you decide or find out if you're eligible or not, you will have to initially submit a notice of interest. As part of that notice of interest, you're going to have to include a phrase like that reasonable expectation to save lives and minimize injuries to justify why you're asking for earthquake early warning. And you're going to want to include some information about why your facility may be in an earthquake vulnerable area. Along with that, you're going to have to submit a cost estimate. You have to tell Cal OES and FEMA approximately how much money are you looking for. So along with that, you're going to want to reach out to vendors to obtain those cost estimates. You will need some bids for that. So definitely something that you'll want to take into consideration ahead of time, because sometimes it takes a little bit of effort and a little bit of time to get those bids in place for your notice of interest. And you're going to want to describe in your plan thoroughly and accurately what you plan to do. If your notice of interest gets approved, you cannot change the scope of work after that. So as you'll see when we put in our notice of interest, next few slides, it was very specific. And as we learned some of these things, as we rolled the system out, we were still tied to that initial notice of interest, and it really drove a lot of our implementation activities. So let's say your notice of interest is successful. That's excellent. Now comes really the heavy lift part, where you have to submit your project sub-application. You will need to commit a 25% organizational match. So again, this is where it's important to know what those bids look like ahead of time, because you'll need a letter from your organization saying that your 25% match to the exact dollar amount is guaranteed for this grant program. You may or may not need a FEMA environmental checklist to be completed. And I should revise that to say you will need to submit one, but depending on how you implement your system, your environmental checklist may be very quick. For us, we weren't changing anything significantly about the structure of the building or the way it looked on the outside. So it was a pretty simple process. You will have to follow the grant contracting guidance. So when you're getting your bids and your estimates, make sure that you're following that guidance that's posted on the Cal OES website. You'll need that cost estimate spreadsheet, which breaks down the bid and by timeline. So you're going to want to break it down from purchasing hardware to software or licensing agreements to installation costs, and kind of lay it out as any other construction type project with different milestones and timelines, and how much money will be spent at each of those timelines. And then you're also going to need a project maintenance letter. How are you going to maintain the system when the grant money runs out? The grant performance period is not indefinite. When we applied, it was 3 years. So we were very concise about how we were going to maintain the system 4 to 3 years, but then they also wanted an extended maintenance letter. So how we were going to maintain it beyond the 3 years that the grant was actually going to support this project. So if your documents are approved and you are awarded the grant, that's where you're going to get into the next set of documents, which are your post-obligation documents that are going to tell you how you're going to implement this project, and you're going to be communicating back and forth with Cal OES. And then you get to the fun part. You've implemented your project, everything's done. You get to your closeout where you let Cal OES and FEMA know that everything's been installed. You've tested the system, you've done your education, and everything is good to go. And then you get your reimbursement check back. And that reimbursement check will cover that 75% that FEMA will and Cal OES will match through the HMGP grant, and then also showing your 25% match. So what did we do here at Cedars-Sinai? We started initially with the software that is pictured here. This was called the user display, and it was a beta test to see, what benefit would we get from this system. And we noticed that we could get potentially up to a full minute of warning. And that was really good for us to see for a few years with the software test, like what can we do within that time frame, and what's reasonable for us to implement with about a minute or less of advanced warning to an earthquake. So our initial integration went with our two-way radio system. It was very easy, very quick to do. Under an hour total to get that done, where we connected our early warning hardware to our two-way radio system, and it put out an audio alert to all those radios saying there's an earthquake coming. The other thing we wanted to do was to tie it into our overhead paging system. because not all departments carry radios, and it's a big structure, big campus, as you can see on the bottom part of this picture here. And that was the best way to reach all the buildings in a timely manner. At the time of implementation and still currently, we discussed some of the items down here and whether we should or could implement them. We discussed elevator recall. One of the things we experienced in a prior earthquake was elevators stopped due to the seismic sensors. So could we get those elevators recalled, ideally to the nearest floor, open the doors and make sure staff members, patients weren't trapped in those elevators once the shaking started? We took a look at imaging equipment. Could we put those items into a safe mode or a park mode so that with that unexpected loss of power, that it wouldn't, shut down the machine as if somebody just pulled the plug on it, but we could park in a safe mode, which meant that restoration would be a lot faster. The same for laboratory equipment. Again, if, for example, if you can slow down a centrifuge before it loses power, you can get the system restarted faster. You can hopefully save the specimens that are in there, and just minimize any sort of downtime or disruption. Specifically, we were looking at operating rooms, and within operating rooms, cautery equipment. Cautery equipment could potentially cause a fire, if it's dropped or something happens to it during the earthquake. So there's discussion, do we want to shut down that cautery equipment? And do we want to warn surgeons about the earthquake? And some of the discussion here was, are we going to startle them with this alert message or not? And then finally, our central plant. Do we want to start the generators before there's that loss of power? Do we want to shut down maybe the flow of certain chemicals and pipes to prevent, an accidental spill if that pipe shears? And when we were looking at all these options, we decided not to implement it at the time, just because there were still a lot of questions out there. I think at the end, Josh may be able to share a little bit more about the elevators. I know he's been working a lot on trying to get that approved. Unfortunately, fire codes are dated and they weren't necessarily written for this brand new technology. Well, brand new at the time. Now it's been in place for a few years. And it wasn't within existing code, for example, to recall the elevator to the nearest floor. For us, we would only be approved to recall the elevator to the ground floor or the alternate fire floor. And in the picture, it's 8 occupied stories, but with the interstitial, like utility floors, it's a 16-story building. So if we're recalling an elevator that happens to be on the top floor all the way to the ground floor, it's probably not going to make it all the way down before the shaking starts. So that really wouldn't create any benefit for us. With the imaging equipment, we decided not to do it because, again, we are going to give the audible warning, and the technician can hopefully have enough time to manually park that imaging equipment in a safe mode. They have time to protect the patient at the same time, and so it's going to be a manual response. The same with the laboratory equipment. There's, lab clinicians in those areas. They can safely park their equipment. In the operating room, probably had the most discussion here about what we were going to do there. Talking with quite a few surgeons, they felt that they wouldn't be, unnecessarily startled by this type of alert. They're kind of used to, fire alarms going off for whatever reason, and it doesn't really startle them. And this was a very similar type of implementation. Also, for the cautery equipment specifically, they wanted the option for where they were within the procedure on what to do with that cautery equipment. If they had a patient that they need to use that equipment on urgently, for example, they would bleed out if something was not cauterized in time, they wanted the option to, brace themselves and still make that happen. But at the same time, if it was less critical, if they could, get the scalpel out of the patient or turn off the cautery equipment, they would do that. And that's part of our education as to what to do when they hear this warning. In the central plant, the way our generators start is through compressed air. So there wasn't the fear of the generators not starting with the power loss. However, looking at some of our offsite buildings that don't have that compressed air generator start, there was discussion that this may be a benefit specifically there so that they would have city power to help make sure that the generator started before that power was lost. And those generators usually use a battery to start. And the ones that the hospital maintains, our plant operations department does excellent maintenance on it. But some of our leased buildings that we don't have full control over, that's a little iffier for us. We haven't had problems in the past, but just looking at what happens across the country, generator failures are a real issue. So this is a map of our campus, and we had to decide where are we going to roll the system out. And we went for the buildings that are highlighted in yellow because they have peak occupancy, either of staff and mainly for patients. And these were the areas where we felt it could protect our patients the best. We do have some off-campus locations that are not part of the system, but they are primarily either fully administrative or they have limited outpatient visits. So how did we set this up? What are we going to tell people about? With all clinical alarms, there's the issue of alarm fatigue. So if we set the alarm threshold too low and we let everyone know about every little earthquake that you don't feel, obviously we're going to burn people out on these earthquake alerts. So initially, we decided that we were going to put our alarm at the Mercalli intensity scale level of 5, which is moderate shaking. As you can see here highlighted, damage would be very slight, but we thought this would be reasonable that staff would want to know about it. And we said at the time that the threshold may be changed. Well, then we had the Ridgecrest earthquake in 2019, and even though it came in as a weak level of shaking, it would have been a level 3. The alarm didn't go off for that, but staff said, you know what, that was strong enough that we'd want to know about it. But just looking at the frequency, weak level of shaking, there were still a lot of those earthquakes, and we didn't feel it was enough to send out this big message to everybody for that. So we came to a compromise and decided that we were going to send it out for level 4, which is a light level of shaking. As you can see, there's not going to be any damage, but because we're in that tall building, the hospital being, effectively 16 stories up, that if you're on that 8th floor, the top patient care floor, the building's going to sway back and forth a little bit. And people want to know about that so they can brace themselves. So even though we brought it down, it would not have activated for that earthquake. But what it did activate for was just a couple months ago with the earthquake that happened in Ventura near Ojai. It did activate. It provided between 10 and 15 seconds of warning, depending on which system you heard the warning on. The radios are a little bit faster than our overhead fire alarm system, just as it needs a few seconds to key up the microphone, play the initial tone, and then send the message. So when we look at what does this take to install, we had to install the hardware that's pictured here. You can see on the right hand picture, that's the hardware along with our two-way radio in a networking rack in our security command post. The picture on the bottom has a close-up of what that hardware actually looks like. This is pretty small, and the picture doesn't do it justice. The hardware itself is about the size of a laptop. It weighs it weighs as much as a very light laptop. It weighs a lot less than my laptop. But we still had to have it secured, mounted, and approved. So within our hospital installation, we had to go through OSHPD or HCI to get approval from them. So we had to submit mechanical and electrical drawings to them. They had to review and approve those. We also had to meet with our fire and life safety and area compliance officer to get their approval. And because this was a pilot for us, as far as I know, we were the first hospital in California to do this. As far as they knew, it was the same thing too. There weren't existing codes that we could leverage for this, so it was a lot of discussion back and forth. I got to say they were really great to work with. They wanted to make this succeed, but at the same time, they wanted to make sure that we were going to do this in a compliant way and not jeopardize anybody's health and safety. So this was the longest process. And when you get into that grand timeline, at a minimum, I would say allow for 6 months to this, possibly up to, I'd say even a full year, just as I'm sure your construction departments know, with any sort of construction has to go through OSHPD or HCI, it does take some time. Then in our other building, which is not an OSHPD building where we installed this, it is just an LA City high rise. We had to go through LA City Building and Safety. It was an over-the-counter permit. It was a lot smoother. I'll get into a minute, also working with LAFD specifically on that, which is a LA City specific issue. So the hardware that we put in was the early warning hardware, which I mentioned is like the size of a laptop. We put in a dedicated two-way radio, which you can see on the bottom picture on top. And working with our radio vendor, they put in a feature called All Call. It's a Motorola system here. And what that does is it keys up every radio channel that goes through our repeater, and it's going to put out the same message simultaneously on all those channels. We also put in a UPS battery backup because we want to make sure that this system does have power. And I'm really confident that for that first earthquake, power is going to be fine. But what happens with earthquakes? We have aftershocks. And what happens if we're on generator power? At that point, there's usually about that 5-second gap of transition between city power and generator power. So in that gap, we want to make sure that the system could maintain power and not have to go through a hardware reset or anything like that. So that was ready to go for any aftershock. We needed a network port, which I thought would be so easy. That was also a big challenge. And along with the network port, we also had our IT security teams review all this, approve it, see what was coming in and out with the system, and they were okay with it and okayed the installation. And then we had to have new cabling and conduit to connect this to our fire panel. And that's because the system sends the alerts through the fire alarm PA system. So this is what it looks like in our other non-OSHPOD, non-HKI building. So instead of putting in that rack, we have this portable network rack, sits under the desk there. For this one, we did have to get an LA City building permit. We did have to get an electrical permit for this, and also LA City fire approval. And this, again, was a negotiation with them. There is nothing in the fire code that says that you can put these types of alerts over to fire alarm system. In fact, specifically NFPA and LA City Fire Code say you shall not do anything but a fire alarm over announcement over the fire alarm system. However, having them understand really the life-saving nature of this, and that much like a fire alarm, we're trying to prevent injuries or worse, they did agree to it. There were a number of things that we had to do. For example, make sure that no matter what was going on, that this had the lowest level of priority on the system. So if a fire alarm goes off, that overrides the system. If our security command center is picking up the mic and putting out the fire alarm announcement with the location, that overrides the system. But once we reprogrammed the fire alarm system to make sure that would happen and demonstrated both to OSHPOD and LAFD, they were okay with the installation, and they gave us a variance on the fire code. And hopefully soon the fire code will catch up, and this will be one of those approved systems. We also had to get into the weeds for what is the message that's going to go out. And we ended up deciding on what you'll see here with earthquake, expect shaking, drop, cover, hold, protect yourself now. And HKI/OSHPOD was very concerned about what the message is for patients who may be in bed, they may be unable to get out of bed, do this drop, cover, hold, and protect themselves now. As part of the pilot agreement, this was with USGS to implement this. This system was really targeted at staff. And at least in our hospital, we don't have fire alarms within the inpatient rooms. The alarms are in the corridors outside the patient rooms. So they're probably going to hear the alarm. But they may be dependent on staff to help protect them. And that's where we modified the message. So you'll see drop, cover, and hold is there primarily for the staff. And the protect yourself now is really geared towards patients. Maybe the patient can cover their head with a pillow or their hands. That's the only way that they're going to be able to protect themselves, because they have IVs, they're ventilated, etc., and really unable to do anything more to protect themselves from the shaking. Let me play this audio here so you can hear what the alarm sounds like through our systems.
This is a test. This is a test. Earthquake. Expect shaking. Drop. Cover. Hold on. Protect yourself now. This is a test. This is a test.
So that was the message that we put out yesterday during the shakeout drill. We let everybody know we're doing the drill, and that message went out over our two-way radios and our fire alarm PA system. So just like with anything else in emergency management, we have to educate people about it. We can't be the only ones that know, what's going on. So we've done multiple presentations, both at the department level, hospital-wide. We put this in our flyers in our weekly newsletter. So on Wednesday, the newsletter went out, and there was a story in there that said, hey, we're going to do this test tomorrow. And then we have web pages built out there with more information for staff. It is also included in our new employee orientation and the annual refresher health and safety training. Along with the possible benefits of the system, we do educate people on some of the potential limitations. Depending how far the earthquake epicenter is from the medical center, there may be no warning at all or very little warning. And there was a minor earthquake a few years ago. I think it was a 3.1. Epicenter was Beverly Hills, so under a mile from the hospital. The alert went off, but it went off after the shaking. And there really was no way to provide advance warning because we were almost on top of the epicenter. It would have been under a second of any type of warning for that. There could be a false alarm. This hasn't happened to us, but I know yesterday some of you may have downloaded Earthquake Early Warning app, and at 3:19 a.m. A false alarm went out, and it did say it was a test. But we just tell people, things could happen. Accidents happen. It could be a false alarm. So while we hope that they drop, cover, and hold and help protect their patients, just understand that if they don't feel any shaking after about that full minute of potential lead time, that they should, resume normal activities. There could be that concurrent announcement. So this is, that perfect storm that it could occur is that there could be a fire alarm going off at the same time that the earthquake strikes. And because that fire alarm has to override the early warning system, that message may not go out. And potentially in a significant earthquake, the earthquake could damage the system itself or the cabling, or we could lose power. And as much as we've tried to mitigate that, there is a possibility that we wouldn't have a warning for aftershocks. We do these system tests. We announce those. So as I just mentioned, we participated in yesterday's shakeout exercise. And we did another drill earlier this year in February, just some of the follow-up items from our prior drill where we really wanted to tweak some of the audio levels and make sure that the announcement was being heard clearly in all the intended areas. So what do we tell people to do or staff to do with this advanced warning? If we provide it and it results in panic or confusion, that's really not going to help anybody. We're not having any meaningful impact. So what we tell our staff to do is alert other staff who may not have heard the alarm, tell patients and visitors of the impending earthquake, tell them how to protect themselves. If possible, move themselves and patients away from the windows or anything that may fall over. If they're near or using an item that has wheels on it, apply those locks. This could be for beds and wheelchairs and carts. One of the interesting things we found out with this education, we said lock the IV poles. And the nursing staff came back and said IV poles don't have wheel locks on them. So that's part of learning, and now it's secure those items which may tip over. So it could be somebody holding on to it or trying to move it away from a patient so that if it does topple, it doesn't cause additional injury. If there's a sturdy table, desk, anything that you can get under, we want staff to do that. Much like our other emergency training is the staff have to protect themselves so that they're able to serve our patients after this earthquake and after the shaking stops. We stick with that message of drop, cover, and hold on. And you can see some of the modifications here that, we didn't develop. This came from, I think, USGS and Caltech and Cal OES about the different ways to protect yourself if you're in a medical environment. You see the picture here with the wheelchair or with the walker. And it's really nice that we're able to provide that education, which is realistic for the patients that we serve. Want people to stay sheltered until the shaking stops, and that everybody should expect aftershocks, especially if it's a big earthquake. We know aftershocks are to come. So just something to be aware of. And, as they do some of these protective actions, don't automatically go back and reset everything the way it was. Expect that this is an opportunity to really mitigate some of that damage from the aftershocks. Going back a little bit to the automated response. So while the system that we installed does have some capabilities for additional automation, these were things that we left out, but we may still consider in the future. I already mentioned that we're not going to do automated equipment shutdowns. After talking with our employees, physicians, we really came to the decision that providing them with information is the best thing we can do in an earthquake. We don't want to automate any of their actions because there are so many variables within healthcare as to what the current situation is, either in their surroundings or with the patient themselves, that they may need all the tools still available at their disposal, and we didn't want to force their hands by shutting anything down. As I mentioned, we're not going to start our generators before shaking. And we really are interested in that elevator recall. So that's, I think, one of our top items that we really want to pursue, and hopefully some of the code will catch up and make that more successful for us in a high-rise hospital. So where do we go from here? We've done our initial rollout. We've put the system in buildings. The radios are really, really helpful for not just backup communication, if our phones go down, like it probably will after an earthquake, but it's also a really good way to send that notice out. During some of our drills, staff came back to us and said they couldn't hear the alarms. There's a lot of construction going on and modifications to spaces. People are wearing headphones and they're not hearing the fire alarm that's happening in the hallway. So the radios can bring that alert into certain areas that don't necessarily have full fire alarm coverage, or maybe they hear the tones, they hear, the code red for a fire, but they're not hearing the details of what comes after that. Radios are a good way to get around, not, I won't say get around that, to enhance that type of communication, but also provide them with a way to communicate after the earthquake if their other systems are down. We're looking at how we can put the system into new construction. So there's new buildings, new construction, always new hospitals going up, and how do we get this in place within new construction? For our implementation here, we are dealing with a 50-year-old building, and the fire alarm system was the best way to get a public address type of message out there. If we had our way, and if the fire department had their way, this system would be separate from the fire alarm PA. So if you have the opportunity in new construction with other types of overhead announcements, maybe that you use for medical emergencies, like a code blue type of announcement, that may be a potential way to implement this. We are advocating for everyone to download the MyShake app from Berkeley. People are really excited that they have the system here at work. And so the question was, well, how are you going to alert me when I'm at home, or I'm at the movies, or I'm on the road? And this is a really good way for them to take that app with them wherever they go. We include it in all our emergency management committee meetings and all our presentations, just to make sure that everybody has the opportunity to take this warning with them. And with that, I want to open it up for any questions. My email's up here. If you decide to go through with this and you have questions on the application process or the grant, I'm happy to share what I can. Cal OES, I have to say, is really your expert source for grant-related questions. And on that website that put in the chat and display on these slides, they have a lot of guidance documents on how to apply for these types of systems. So let me open up for any questions.
That's great. Thanks, Ryan. It looks like we have to go strictly through the Q&A. I don't think